pleasure to see you all, to welcome you, to all
This symposium on palliative care was brought together as a cooperation or a collaboration between the Canadian Conference of Catholic Bishops and the Pontifical Academy for Life, with a number of other vocal representatives from a number of different, not just pastoral communities, but clinical settings as well, who wanted to come together to create a forum where we can talk about death and dying.
And also to establish a strategic framework to promote palliative care and also express in a positive way the necessity and the beauty of palliative care. With the vision of hope.
The ethical, the theological, the clinical foundations were laid very importantly at the beginning of our discussion so that we can get really into the nitty-gritty of some of those bigger discussions and reflections around palliative care and end of life. We talked about woundedness, vulnerability, concepts of human dignity and flourishing, which are all very much part of the palliative care model already outside of the Christian tradition. But I think one of the take-home messages of the entire symposium has been that we should be cultivating a palliative care culture and less of thinking about palliative care as just another branch of medicine, but something that should be properly integrated in a full ecosystem of care. Instead of spending 11 seconds commenting on each and every one of these up here on the screen, I'm going to instead paint with broader strokes.
Corey's presentation touched my heart the most in that he took palliative care and vulnerability to a greater depth by using the Latin meaning of palliative and vulnerability. And it just made me understand palliative and vulnerability so much more. All of a sudden, my foundation was so much sturdier and stronger because now I can build on that.
We did have the various perspectives there on the question of palliative care from other religious traditions, Muslim, the Jewish, also other Christian denominations, as well as the indigenous. I found it very, very encouraging to listen to that because it reaffirmed how palliative care is such a broad-based concern.
I can be a great help for the patient, but what I see concretely is that the patient brings me so much more. I've encountered so many people who have become mothers, fathers, grandparents, brothers and sisters for me. They've taught me how to say yes to the present circumstance I was living through their own yes, to their own circumstance.
Really underscores just how broadly based this concern is for good quality palliative care and the broad desire really to advocate here and elsewhere in the world for access to palliative care. There's so many areas of the world where people who really do need it don't have access to it.
So I've had the opportunity to work in over 20 countries, mostly in Africa, Latin America, and the Caribbean, and share some stories of some palliative care leaders and show us that this can actually be done. So both the practical, technical ways to do it, but also the way that it can change and inspire culture when you have people that put compassion and put the suffering of the poor at the forefront and how we can be with them in that and partner together with communities, often communities of faith as a way to do it, the progress that we can actually make.
The Indigenous presenter was talking about the various ways in which the individual is covered, and there's the term, pallium means cloak or covering, right? So is covered by the care of the whole community.
Tell you what it is, but you can read it.
I knew a lot of that, but it just helped me understand it a lot more, how important ritual is for the Indigenous people. I feel equipped with more understanding now.
To surround and cover someone with love, communal love, really affirms the dignity of the person regardless of their circumstance.
For most of us, we have so many people around us who are in need of very simple things done with great love. It will bear so much fruit if we just listen to this first impulse of the heart to say, yes, I am present for you.
What was really beautiful out of today is highlighting that really to integrate palliative care has to go beyond the healthcare system, and that it's actually inspiring a different culture and a different way of how we think and how we live together in community. When we have an opportunity to come together and reflect on what our church says about what it means to suffer, and we can bring, well, this is what I saw last week in Central America, and let's think about how this connects. I think there's just immense opportunity for growth and refine our vision of what it means to be together and make this world a more just place.